You have been referred to Roswell Park for Mohs micrographic surgery as a treatment for your skin cancer. Hello, I'm Dr. Bax.
And I'm Dr. Brady. We hope this video will help you better understand Mohs surgery and what you can expect during your procedure.
Skin cancer is now the most common form of cancer in the U.S., with greater than 5 million cases diagnosed each year. Skin cancer forms in the tissue of the skin.
All cells reproduce by dividing. The process of normal tissue growth is usually controlled. When uncontrolled, however, abnormal growth results in masses of tissue called tumors, which can be benign or malignant. The two most common forms of skin cancer are basal cell carcinoma and squamous cell carcinoma.
Mohs surgery is the most effective treatment and cure for skin cancer, with a cure rate of up to 99%, which is higher than any other form of treatment. Mohs micrographic surgery was first developed in 1936 by Dr. Frederick Mohs at the University of Wisconsin.
Since then, it has been refined to produce the impressive cure rates we see today. Mohs surgery is suitable for skin cancers that are located in areas where it is important to preserve as much normal, healthy tissue as possible for the best functional and cosmetic result, have come back after previous treatment, are large, aggressive, or growing rapidly, or that do not have clearly defined edges, or that develop in immunosuppressed patients.
Mohs surgery methodically and accurately maps exactly where the cancer cells are. Using the precision and accuracy of a microscope, your surgeon can trace the cancer right down to its roots and remove only the diseased tissue, leaving as much healthy tissue as possible, and ensuring that the removal of all the affected tissue while leaving healthy tissue intact. This results in faster healing times, less scarring, and a low probability of the tumor returning.
As your Roswell Park Mohs surgeons, we are members of the American College of Mohs Surgery. This requires that we have at least 1 year of training and experience after dermatology residency and have completed at least 500 cases of Mohs surgery and reconstruction. Both Dr. Bax and I now have each performed 2,000 to 3,000 Mohs surgeries.
Mohs surgery requires a team approach. We will serve as both your surgeon, removing the tissue, and your pathologist, studying the cells and tissue under a microscope. On your team, there will also be a nurse practitioner or physician assistant who will assist at the surgery, specialty trained nurse or medical assistant, histotechnologist who will prepare the microscope slides.
Mohs surgery is an outpatient procedure that is usually performed using only local anesthesia. We first anesthetize the surgical site. Then we remove the visible tumor and any additional tissue or layers of affected skin. The area of your incision will be marked with small hash marks to map the area where the tumor was removed.
Next, we will temporarily dress your wound and escort you to a recovery area. While you wait, the removed tissue is prepared for examination in our on-site laboratory. The removed tissue is dyed and divided into sections. We then prepare a map to match the removed tissue to the small hash marks we placed on your surgical wound. This way, we know exactly where the tissue has come from. The tissue sections are then frozen and put on the microscope slides.
We carefully inspect the tissue under the microscope to make sure we have removed all the cancer cells. It is critical that the Mohs surgeon is also the pathologist reviewing the slides. This allows your Mohs surgeon to precisely pinpoint where the tumor is on your skin and remove only the cancerous tissue. If it is determined that additional tumor is present in any of the sections, the Mohs surgeon will return to the area and remove additional tissue until no evidence of the tumor remains.
Skin cancers can grow deeply and develop roots that extend beyond the area that you can see. As a result, the size of the surgical incision depends on the extent of the tumor. 2 or 3 surgical layers are common, but you may require more. Since this is all performed on the same day, your procedure may take several hours, depending on how many times we have to remove additional tissue.
When it has been determined your skin cancer has been completely removed, your doctor will decide how best to manage your wound. The decision will depend on the size and location of your wound. In some cases, the wound is allowed to heal by itself. This is called granulation. In other cases, the wound is repaired with side-to-side stitches, a skin graft, or a flap.
For either method of healing, your nurse will review written instructions on how to care for your wound at home. Thank you for trusting the Roswell Park Mohs surgical team with your care. We hope this video has answered many of your questions about Mohs surgery and what to expect.
Please feel free to ask us any questions you have before we begin your surgery.